Here in Oyo State, government has made a strong push for improved child health and immunization coverage across the state, while ensuring that no child is left unprotected against vaccine-preventable diseases. This was as the wife of Oyo State Governor Tamuno Minini Makinde flags off the integrated measles rubella vaccination campaign in Ibadan. Grace Ayoleke brings us details.
A strain of the measles infection, rubella, has been identified to cause serious birth defect, including hearing loss, heart defects, and developmental delays, making vaccination crucial. To ensure that no child is lost to this disease, the Oyo State government kicked off the integrated measles rubella vaccination campaign to reach children between the ages of 9 months and 14 years across the state. Flagging off the campaign in Ibadan, wife of Oyo State Governor Tamuno Minini Makinde represented described the vaccines as vital investments in child health.
Not to talk of the cost, if the diseases that may result from not taking these vaccinations, it may lead to death, and it may be very expensive at the end of the day. So that is why it is prevention is better than cure.
Health experts commended the state's proactive health initiatives while assuring that hard-to-reach communities would not be left out in the campaign.
We commend the states is that they are the first in the southwest to actually roll out this vaccine. But the good thing also is that we are integrating. We are not just giving measles rubella, which is a new vaccine. In 2 LGAs, there will also be neglected tropical disease interventions to ensure that we keep our costochindritis and refractive filariasis away.
Vaccine is very good to take so that it will give the child a proper growth when growing up. It won't cause negative thing in the child health or anything that will make you spend money than this.
The integration vaccination campaign, which also covers HPV and polio vaccines, beneficiaries say underscores the Governor Seyi Makinde's led administration's resolve to build a healthier future for children in Oyo State. Grace Ayoleke, NTA News.
Okay, with me in the studio is a public health nursing officer and a local immunization officer in Oyo State, in person of Omolade Olanrewaju. You're welcome to Panorama.
Thank you.
We just heard that background report telling us about the flag off of the immunization exercise for measles, rubella, and other preventable diseases. Can you explain what the rubella virus is actually and how it affects the human body?
Thank you very much. The measles, rubella virus is a very deadly and highly contagious disease that affects our children if not well prevented through vaccination, and could cause a serious complications like brain damage, death, and can cause deafness and blindness and all sorts, and paramountly death.
Okay. So looking at the exercise, since it was flagged off and you've started already, I believe, how will you describe the response of the people of Oyo State to this immunization exercise?
Thank you very much. Really, we have been getting a positive response from the people of the community because we intensify on our ACSM activities, advocacy, communication, and social mobilization. Through the Oyo State government, the state health educator, throughout the local government, we engage all our ward level elders, community leaders, religious leaders, and stakeholders and non-governmental organizations to really advocate for us and spread the news so that people will be able to have knowledge about the vaccination and be able to take for their children.
So would you say the response have been good? Are they coming out or?
Yes, ma'am. Yes, ma'am. The response has been very good. And where we had gaps, they are calling us immediately and we are going there to fill the gap. Where we cannot solve as immunization officers, we call the state, and the state come to our aid. Even the teachers, the LIE, any of the schools that did not want to allow us, we call on the LIE. He comes there immediately because we carry everyone along.
Okay, how important is this vaccination?
Yeah, this vaccination is very, very important because, like I said earlier, it prevents them from complication like pneumonia, brain damage, and death majorly. Then it prevents pregnant mother too, by preventing their unborn children from having the infection.
Okay. We heard in the background report that it is not only the MR vaccine that is given. What other diseases are vaccinated against and why?
Yes, ma, because this is an integrated campaign program. So, inclusive, we have the HPV vaccine, that is for cervical cancer, to prevent cervical cancer for girls. Then we have the NOPV to prevent our children from poliomyelitis. Then we have all our routine immunizations that we used to have in our health facilities along with them.
Okay, before I let you go, I want you to talk to people. What will be your advice for mothers, caregivers, and handlers of children while this exercise continues?
Thank you once again. Yeah, my advice to our caregivers, guardians, and our mothers at home is that we should cooperate with us and let our children, those eligible children, let them be immunized to have a safe community, a safe state, and a safe nation. Because all these diseases that are prevented by vaccination, that is the vaccine preventable diseases, they should be taken. And we should not deny our children because they have their own right to immunization.
Thank you very much. That has been Omolade Olanrewaju, a local immunization officer in Oyo State, talking about the significance and relevance of the ongoing immunization exercise. Thanks again for coming to Panorama.
Thank you.
We'll now take a break for some messages. Panorama continues shortly. Do stay with us.